Welcome, and thank you for turning to Home Helpers for help in caring for your loved one who has had a stroke. In this video, we will briefly explain what causes a stroke, the effects a stroke can have on a person, and what family, friends, and loved ones can do to make things a little better for someone who has had a stroke. First, let's understand the definition of a stroke. Put simply, a stroke is a sudden interruption in the blood supply to the brain. Most strokes are caused by an abrupt blockage of arteries leading to the brain, such as from a blood clot. Other strokes are caused by bleeding into brain tissue when a blood vessel bursts. Because stroke occurs rapidly and requires immediate treatment, stroke is often called a brain attack. If you are caring for a loved one who has had a stroke, you are far from alone. More than 7 million people in the United States have survived a stroke and are living with its effects. It's estimated that 80% of American families are touched by stroke in one way or another. How a stroke affects a person depends on several factors, including what part of the brain and how much of the brain was damaged. Because one side of the brain controls the opposite side of the body, a stroke affecting one side will result in neurological complications on the opposite side of the body. For example, if the stroke occurs in the right brain, the left side of the body will be affected. Complications after a stroke can include paralysis in one limb or one side of the body or face, a loss of sensation, loss of balance, loss of bladder control, decreased level of consciousness or alertness, complete or partial blindness, and difficulty swallowing, among other things. The severity and number of effects from a stroke depends, again, on the placement of the stroke and its severity. An attack on the right side of the brain may cause paralysis on the left side of the body, vision problems, behavioral changes including quick actions, and memory loss. If the stroke occurs in the left side of the brain, the right side of the body will be affected, producing some or all of the following: paralysis on the right side of the body, speech or language problems, slowed actions, and memory loss. How many of these effects and their severity depends on the location of the stroke and how severe the stroke was. After a stroke, many people are left with problems related to speaking and understanding language. Reading, writing, and math skills may also be affected. Language is much more than words. It involves our ability to recognize and use words and sentences. Language is our means of communicating our thoughts, our desires and needs, and our ability to ask questions and our ability to learn. A stroke that affects the left side of the brain may lead to aphasia, a language impairment that makes it difficult to use and understand language. Aphasia can be frustrating for both the stroke survivor and his or her loved ones, but therapies are available. Seeking out professional therapies can help you and your loved one. In addition to speech therapy, music and art therapies also can be beneficial. To find a licensed therapist trained in the treatment of aphasia, visit the American Speech Language Hearing Association at asha.org. To find a support group for your loved one or for yourself, visit the National Aphasia Association at aphasia.org. This site also has lots of helpful tips for learning to communicate with your loved one. There are things you can do to help your loved one communicate. First, it's important to remember that aphasia affects a person's language, not his intelligence. The person can think, he just can't say what he's thinking. You can help by first getting the person's full attention and make eye contact before speaking. Turn off the radio or television and do what you can do to rid the room of distractions. Next, speak clearly and slowly, but not loudly. Their problem isn't with hearing. Express one idea at a time in a clear, simple term. If a person doesn't seem to understand something, find a new way to say it. Use hand gestures and pictures to help the person understand. Most stroke survivors can improve their ability to communicate, but no one can tell you just how much improvement to expect. The fastest improvement usually happens in the weeks and months right after a stroke. Between 6 months and a year, progress may slow down. But with ongoing effort, improvements may continue for years, though typically at a slower pace. The body isn't the only thing affected by a stroke. One of the most common complications is depression. Stroke survivors are often frustrated and saddened by the loss of independence that comes as a result of paralysis or loss of mobility. Many find having to rely on family and friends or other caregivers for personal activities like bathing or toileting to be embarrassing or demeaning. Others bear guilt for being a burden to their loved ones. As a caregiver, watch for signs of depression, such as loss of interest in things that the person previously enjoyed, unusual sleep patterns, or a loss of appetite. If you suspect that your loved one is depressed, report it to his or her doctor, who can recommend medications or therapies to help. Have the person who has had a stroke do as much routine self-care as possible. Doing things for themselves promotes pride, confidence, and independence. Routine is important, but also includes some variety in the person's day. This may seem contradictory, but a schedule provides security and comfort for both the stroke survivor and the caregiver. For instance, a schedule of getting dressed in the morning, eating breakfast, moving into a comfortable chair, and watching a favorite television program gives your loved one peace of mind. They also can feel that they have some control over their day as they watch the clock, knowing that certain activities will occur at specific times. However, daily activities should be varied so that your loved one doesn't become bored, doesn't stay in one place or one position for such a length of time that the body and mind become numb. Staying in one place for hours at a time is uncomfortable, physically and mentally. If one side of the person's body has been affected by a stroke, be sure to encourage use of the good side. Place a tray or table where the mobile hand can easily reach things like a cup, tissues, or a phone. Music is an amazing thing. Some stroke survivors who have trouble recalling words or forming sentences can remember their favorite songs word for word. Words that they have trouble speaking can sometimes come out crystal clear when put to music. Enjoy music with your loved one. If he is having trouble pronouncing a particular word, try asking him to sing it instead. After a stroke, something as simple as eating from a plate can be frustrating. Be patient while your loved one relearns things he once took for granted. Small changes can make a difference. Try using a plate with sides, similar to a pie plate, to help your loved one scoop up food. Be sure to include your loved one in conversations. Although they may not communicate easily, including them in conversations is good for their positive mental outlook. Stroke survivors will find that simple tasks they once took for granted are now extremely difficult or impossible. Make adaptive devices available and try new techniques that have been designed especially for stroke survivors to help them retain their independence and function safely and easily. For personal grooming, a long-handled brush, a washing mitt with pockets for soap, soap on a rope, an electric toothbrush, and an electric razor all can make things easier for the survivor as well as the caregiver. Simple adjustments to the home can also make things safer and more manageable. Things like grab bars, a raised toilet seat, a tub bench, a handheld shower head, and no-slip pads are inexpensive and easy to install. Most are available at your local pharmacy or hardware store. Dressing oneself is a basic form of independence. The added value of being neatly and attractively dressed enhances a stroke survivor's self-image. Let's talk about some ways to eliminate the difficulties in getting dressed. When dressing, always put clothing on the affected side first. When undressing, always take clothes off the affected side last. Clothing that must be pulled on over the head may be difficult to manage, so when possible, opt for items that open in the front. When getting dressed, lay out clothes in the order in which they will be put on. Those to be put on first go on top of the pile. Putting on clothes is easier when sitting down than when lying down. Tight-fitting clothing is much more difficult to put on and take off, and buttons and zippers can be frustrating for someone suffering from the effects of a stroke. Opt instead for loose-fitting clothing. Consider replacing zippers and buttons with easy-to-manage Velcro closures. And Velcro is a good option for shoes as well. If the stroke patient is able to prepare food for herself, help make it easier by putting often used dishes, tools, and foods within easy reach. Lazy Susans placed on kitchen countertops and in low cupboards make spices and utensils more accessible. If the countertop is too high, substitute workspace can be made by opening a drawer at the desired height and placing a cutting board or breadboard over it, or by using a wheelchair lapboard. Make chopping and preparing foods a little easier with adaptable tools, such as a rocking knife. If meal preparation is a struggle for you and your loved one, consider a meal delivery service, or keep healthy, easy options on hand. Eating a healthy diet is important to a person's recovery and overall good health. Encourage your loved one to eat a hearty breakfast, which will give him the energy he needs for the day. Enjoy smaller meals at the end of the day. Special utensils can help if arms and hands are impaired. These include flatware with built-up handles, which are easier to grasp, and attachable rings that keep food from being pushed off the plate accidentally. Rubberized pads under the plate help keep it from sliding. These devices are available through medical supply companies, or some people find success with a plate with sides, similar to a pie plate. If your loved one has trouble swallowing, you may need to observe them while eating, so that they do not choke. Choose soft foods. Tougher foods could be cut into pieces or pureed. Beverages may need to be thickened to keep them from going down the wrong way. Natural thickeners include tapioca, flour, instant potato flakes, and oats. As a caregiver, it's important to watch for signs of some common complications that can result from stroke. Bed sores are skin ulcers that can develop when a person spends too much time in the same position. Steady pressure on one area decreases blood flow and can result in painful, dangerous sores. Patients who are confined to a bed or chair should change positions at least every 2 hours. As a caregiver, be on the lookout for red or broken areas of the skin. Joints that are not used for an extensive period of time will become stiff and immobile. These are called frozen joints, and they're caused by fibrous bands of tissue called adhesions that develop between the immobilized joint surfaces. To prevent frozen joints, help your loved one regularly complete small movements of the knees, ankles, wrists, and shoulders. Poor nutrition can prolong recovery and increase the risk of developing bed sores, as well as other illnesses. Encourage your loved one to eat a high-protein diet with adequate nutrition. Caregiving is a big, often exhausting job. Home Helpers is here to lend a hand. Whether it's to answer a caregiving question, provide an hour or two of respite, or around-the-clock care, consider letting our trained, compassionate caregivers make your life easier.